Thank you very much, and good afternoon or good morning, depending on where you are. I would like to welcome everyone to our first digital forum for the House Committee on Natural Resources. Today's forum is on coronavirus response in Indian country. We are virtually here with tribal leaders from various parts of the country to tell their stories and provide us with input and guidance that can help Congress to adequately and much better address the world pandemic and its effects tribes in this country. At the beginning, toward the end of February and early in March, I had one conversation with a tribal leader who expressed concerns about the potential impact that the coronavirus would have on Indian country and on their tribal lands. And here we are, a little more than a month plus later, and that world pandemic is at our front doors and in our lives, with our families, our lands, our homes, and the economic devastation that is brought with it. I believe that concern that was brought up then was warranted, and as chairman of the committee, I want to ensure that tribes throughout this country are part of the coronavirus response, uh, and that the actions not only at the federal level, but that the conversation continue in earnest and with urgency as we in Congress continue the process of developing larger pieces of legislation going forward. Uh, we need to make sure that Indian country not only has a seat at the table, but continues to be part of the national conversation, but also the response. We have heard from Wall Street, we've heard from Main Street, and what that general impact has been on our country's economy. But we need to also hear from Indian country about what that economic impact has been uh, to Indian country. With that said, I want to welcome our panelists. Our format for this discussion: I'll start with a short introduction of each panelist. Then each panelist will be given about 5 minutes. And when they're done, we'll move into question and answer. And if we have time, a short closing comment. Before moving to the first panelist, you know, this this uh, this pandemic has sort of provided all of us, and certainly I hope the members of Congress have been aware of this, a portal to looking not only at our past but also what the future uh, is about. And $8 billion that was provided specifically in the CARES Act for Native nations and tribes was an important precedent. But the original request was for 20 billion that came from organizations and tribes across the country. So there's more to do that. But now we can build on at least the acknowledgement by the federal government of the importance and the necessity to address Indian country in a very specific way and to provide those resources in a specific way. Part of what I've seen in this portal is tribal consultation, how dysfunctional it is at the federal level, how agencies are either not aware, ignorant, or don't understand what that trust responsibility and the obligation for consultation by the federal government is. Uh, CDC, FEMA, Army Corps, Department of Interior, BIA, and the list goes on, that are responding across the country to the pandemic, uh, have not utilized and followed the consultation process with tribes the way it should be followed. And the other thing I think you see in this portal is the internet, and that it's not that it's now a public utility. It's a necessity. It is not a luxury anymore. And and I think the other thing that we see through this portal that we're walking through is history and the neglect to Indian country, the infrastructure, the water, housing, health disparities, all have made the response in Indian country more difficult, more urgent, and and more imperative for the Resources Committee to continue to be in the leadership role to promote that. I want to give particular thanks to the committee members, many of them in a bipartisan way many times, who have shown great support in our urging when originally there was no money set aside or identified for Indian country, that the package ended up reflecting that something much different and something very necessary. I want to thank them for that. I want to thank the voices that have joined into making sure that there is parity and equity for Indian country. Congresswoman Holland from New Mexico, the chair of the subcommittee on indigenous people of the U.S., Mr. Gallegos, Betty McCollum in Minnesota, and the list goes on. But I do want to acknowledge and thank those individuals for their leadership and for the voices and the advocacy they've been providing on that. With that, let me now turn to our panelists, and we're very fortunate on a very, not, it's understatement to say busy times for the people that are with us, for the leadership that they provided, the ability to change the original package to include Indian country in the CARES Act. A lot of it had to do with the advocacy that panelists that are here today and many other organizations provided and urged Congress to move forward on. I want to begin by introducing Governor Michael Chavera from the Pueblo of Santa Clara in New Mexico. And Governor, you may begin, and the floor is yours and the time is yours, sir.
Well, thank you, Chairman, members of the committee. Thank you for the opportunity to join my fellow panelists in shining light on the pressing issues facing our communities during the COVID-19 pandemic. As Chairman mentioned, my name is Michael Chavarria. I serve as governor for the Pueblo of Santa Clara here in New Mexico, and also as a chairman for the All Pueblo Council of Governors, which is a consortium of 19 pueblos in New Mexico to include the Pueblo of Estado del Sur in Texas. To open, I would like to thank Chairman for mentioning the trust responsibility. The federal government has that trust responsibility to protect the interests of tribal nations, pueblos, and communities, and Congress helps fulfill that obligation by ensuring that Native American Indians, Alaska Natives have access to critical programs and services based on our political status as members of sovereign tribal governments involved in a government-to-government relationship with the United States. So fulfilling these obligations is even more important during this COVID-19 outbreak. Our pueblos are working to mitigate the risk in our communities, to protect the lives of our people through measures such as social distancing, self-isolation, travel restrictions, curfews, shopping day designations, and cultural event suspensions, which is very unfortunate during this time. I would like to thank the Pueblo of Pewaukee has volunteered to use the Hilton Santa Fe Buffalo Thunder Resort as a temporary quarantine site for New Mexico tribal members awaiting their test results. And the first is a deep, abiding concern for the welfare and survival of my people. In the year 2020, the entire world is being impacted by COVID-19, a virus that knows no boundaries, spares none, and affects all the people of all backgrounds and nationalities. Our oral history has taught us by our elders, have instructed us that this time would come. Our elders even told us that our past leaders foresaw a time when the world would be out of balance, and our people would become disconnected from their values and lose the respect for one another, for our communities, polluting our waters, our lands, disturbing Mother Earth through drilling for oil and gas, stripping away minerals for economic gain, again, engaging in war for selfish reasons. Without acknowledging the harmful impact this will cause to our people, all people, and the welfare of the entire world, we have resiliency to see this through this crisis, but our current inability to fulfill, fully engage in our ceremonial and community activities is deeply disturbing, will have immediate and long-term effects on our overall welfare for our people and public communities. Second is a 25% cost share requirement being applied to FEMA public assistance funds, which has put an undue burden on many of our Pueblos, tribes, and nations. We do not have the capacity to assume financial responsibility for that full 25% of that cost. Neither before the crisis, and certainly not even now. Our tribal budget was stressed before the outbreak, and now at the breaking point, we must work to meet the immediate needs of our people. You know, a request for a waiver of the 25% cost match requires urgent need and could achieve this through a simple litigation fix, legislative fix that will eliminate the non-federal cost share. Again, doing so will lift a heavy burden from tribal nations and enable us to invest those funds in strengthening our COVID-19 responses and restarting our economies. We incur tremendous losses due to the closing of our tribal businesses that impact the Pueblo nations. The need for economic relief is tremendous and growing every day. The 20 Pueblos in New Mexico, including Texas, have voluntarily closed our casinos at great financial cost in order to prioritize the health of tribal members and our non-Indian neighbors as well. Several Pueblos anticipate losses of over $10 million in just the first 30 days of the closure. Our casinos and businesses will also be devastating on the state of the economy. In New Mexico alone, Pueblo's businesses collectively generated over 600 million and support over 11,500 jobs annually. Again, without this income, we are unable to provide essential services like healthcare, public safety, elder services, because we do not have a tax base to draw upon for supplementing funding. And so finally, we urge Congress to provide a long-term reauthorization of the Special Diabetes Program for Indians. I do see within the CARES Act that critically needed extension program to November of 2020. However, I am requesting that we further, through Congress assistance, further that extension till 2021. Even more than ever, the Special Diabetes Program is urgently needed in tribal communities. It's one of the leading underlying conditions that contribute to the causes of COVID-19 and increased rates of death. By providing the long-term reauthorization for the Special Diabetes Program, we can ensure that Native people have uninterrupted access to life-changing and life-saving programs throughout the pandemic and beyond. So again, Chairman, members of the committee, thank you for the opportunity to share Santa Clara Pueblo's, the All Pueblo Council's priorities. And again, I would like to stand ready for any questions you may have, Chairman, members of the committee. So, Kundawaha, thank you.
Thank you very much, Governor. And the 25% share, an important point that you've reiterated and other leadership across the Indian country has reiterated. I think that waiver request is very, very important in terms of resources and having the full complement of resources that you need in order to deal with the pandemic and the stabilization that will follow. Let me now turn to the next panelist that we'll hear from is Charlene LeBeau Church, President of and Chief Executive Officer of the Great Plains Tribal Chairman's Health Board.
Good afternoon.
Thank you so much. Good to see you.
Good to see you. Thank you. Thank you, Chairman. Thank you for the work that you've been doing along with the House of Natural Resources Committee and being on the forefront of advocating for Indian country. Just a little bit of background about the Great Plains Tribal Chairman's Health Board. We're a consortium of 18 tribes in the Great Plains region, and the board also manages the Oyate Health Center here in Rapid City. We have been proactive in responding to the pandemic. We're very fortunate and grateful that the health board was awarded $3 million through CDC to help improve emergency response in the region. At the Oyate Health Center, we stood up an additional clinic to respond to the needs within the community of our tribal members that live here in Rapid City and Pennington County. We've already begun planning and executing a regional emergency response center with in anticipation of the funding from CDC. As soon as the press release went out day before yesterday, we began getting calls and have begun providing technical assistance and support to tribes in our region, including 3 affiliated tribes at the Fort Berthold Reservation, which is a hot spot right now in North Dakota. One of the challenges that we're really concerned about is the lack of testing capability. We're very grateful that the CDC and through IHS provided us with one of the rapid testing units, the Abbott rapid testing analyzers. And however, the Great Plains region as a whole only received 792 test kits. Oyate Health Center received 24. So we're not able to provide testing to the public. We're reserving those 24 tests for our health providers. In the event any of them get sick, we can test fairly quickly. We anticipate that at the height of the curve in Rapid City, we will need at least 1,400 test kits. So far, 24 being far short of what the need actually will be. And we anticipate overall in the Great Plains that we will need at least 4,000. The other concern that we have, and I know that I share this concern with many of our tribally run health clinics across Indian country, is the hit that our third-party revenue is taking. In response to COVID and to be fully prepared, we stood up an additional clinic, our Southwest Clinic, to see patients specifically presenting with COVID symptoms. They have a separate entrance. We're trying to keep our healthy patients separate from those that are presenting with symptoms. But in order to do that, we had to decrease our services in primary care. We are unable to see dental and optometry patients at this time in order to fully respond to COVID-19. As a result, we typically have about 450 visits a day, including pharmacy. Right now, that's down to about 160 visits, so a huge impact on our bottom line. So we hope that in future provisions to respond to COVID-19, that Congress will think about the impact of third-party billing on our programs. I'm very proud of our tribal leaders. They have been taking response very seriously, closed their borders. They know the impact that this can have on our population, but that's been made even more difficult with being in states where governors have not issued shelter-in-place orders. So those are some of the highlights of the concerns and challenges that we have in the Great Plains. So again, thank you to you for leading this effort, leading this conversation, and thank you to my colleagues on the call.
And thank you very much. Appreciate your time and thank you for sharing your experience with us. Let me now introduce our next panelist, Lieutenant Governor Peggy Flanagan from the state of Minnesota. Thank you for joining us today, Lieutenant Governor, and the floor is yours.
Thank you so much. Bonjour, everybody. It is nice to see you virtually. And Chairman Grijalva, thank you so much for this opportunity and for your creativity in ensuring that we can still ensure that our voices are heard during this time, even if we're just gathering online. It is really important. My name is Peggy Flanagan, and I'm the Lieutenant Governor, but more importantly in this moment, I'm a member of the White Earth Band of Ojibwe. And as you know, we are looking at this issue and working in partnership with our tribes every single day in the governor's office. You know, this has been a moment in my life, and I know many of you who've been personally affected by this, I lost my brother to COVID-19 just a few weeks ago.
I'm sorry.
And so thank you for that. It has been one of the things that has driven me to ensure that our Native people, that we are seen and we are heard and we are valued, and that none of us are a statistic. And in this moment, President Nez, I would just offer my condolences to you and the incredible loss that your community has also experienced during this time. I certainly didn't grow up thinking as a little girl that my dream was to be the lieutenant governor. It was not a responsibility. It was not every little girl's dream, right? But it was not a responsibility that I could have imagined. And I find myself in a position again, along with the governor, in a responsibility that I could never imagine, which is leading the state and tribal coordination efforts to address a pandemic disease that threatens to devastate Minnesota's indigenous communities. Minnesota is home to 11 sovereign Native American tribes and more than 60,000 indigenous people. Many live on reservations, often located in rural areas, but about 70% of Minnesota's Native population, like myself, live in urban areas. Just one neighborhood in the city of Minneapolis, the Phillips neighborhood, has the third largest concentration of urban Indians in the United States. And I think it's important that our urban populations do not get lost as we are talking about the need to respond here. Tribal communities face the same threats from the pandemic as other communities, except that in our communities, the threats are even greater, as many of you know. Even before the pandemic, unemployment was at crisis levels in our Native communities. And even before the pandemic, our people struggled with poverty, poor nutrition, access to healthy foods, as well as overcrowded housing conditions. And even before the pandemic, over a quarter of the tribal population in the United States was without health insurance, a rate that's more than double the American population at large. And as Native people, as many of us know on this conversation, experience significantly higher rates of diabetes, asthma, heart disease, and other underlying health conditions that can turn a viral infection into a death sentence for our people. Since the outbreak of the coronavirus, these circumstances have combined to create the potential for a public health disaster among the most vulnerable folks in our state. And many Native families, including my own, live in close quarters in multi-generational family units that expose our elders, our precious elders, to diseases that may be brought home by some of the folks from younger generations who live together. Many of our families, of course, as you know, rely on income from tribal operations like retail and gaming. And these operations have been shuttered. When the American economy shut down last month, the restaurants, casinos, stores, and tourism that sustained many of our tribal communities shut down along with it. But also the impact that has on the Minnesota economy overall. Our tribes employ a lot of non-tribal members and are critical to the economy of our state. At a time when individuals need their tribal governments more than ever to step up with food assistance and healthcare, help for school-age kids, many tribal communities found their entire revenue snapped off overnight. And these tribal leaders are making impossible decisions, and it is an honor to work in partnership with them as we are trying to figure out the right strategies here. When it comes to COVID-19, we are certainly all in this together, and we are hearing news coverage about the impact in communities across the United States, except in Indian country, which is why this conversation is so critically important. We have very limited data, as some of you have mentioned, because of lack of surveillance systems and kits, or when the kits are sent out to Indian country or to Minnesota, they are incomplete. The widespread shortage of tests has largely prevented tribes from being able to monitor their members. And in urban areas, Indian health organizations are already running out of money and are running out of personal protective equipment and supplies. So tribal nations need direct access to federal resources for healthcare. The Indian healthcare system, services and facilities that serve large urban populations as well. Tribal government services. Our tribal governments provide critical services like public safety, emergency responses, social services, and many other services that are critical to our tribal citizens. And then tribal economies. Our tribally owned enterprises generate a significant portion of tribal government revenues, of course, but also are critical to the overall economy in the states in which they function. And then tribal community impacts, which I know many of us are seeing firsthand. Our families are experiencing furloughs, school closures, overcrowded housing, and really, again, lack of access to nutritious food. We are doing everything we can. We have a weekly call with our tribal leaders, or sorry, a daily call with our tribal leaders. Representative Betty McCollum participates in those calls along with Senator Tina Smith as we are working in partnership. We are grateful that we were able to establish good relationships with our tribes up until this point, because we have relied on them tremendously as we are figuring out how to navigate through this together. I appreciate you, Mr. Chairman, and of course, Representative Holland, who you highlighted, along with our own Representative McCollum, who have been fighting to ensure that Indian country is visible. During good times, we are often erased and forgotten. And so during a time of crisis, I find myself, fighting and kicking and screaming and doing everything that I need to do to make sure that our people are seen and that we are not invisible and we are also not disposable. So thank you for this opportunity to share my thoughts with you, and look forward to the additional conversation. Miigwech.
Thank you, Lieutenant Governor. And Minnesota is a good example for other states in how to strengthen that relationship with tribal nations in the midst of what we're going through right now. And you and the governor have been at the forefront of assuring that there's equity, that everybody is treated with the level of parity. And I want to thank you for that, because that is an important model for all of us. And I hope other states acknowledge that and copy it, to be honest with you. Let me now introduce our next the next person. Your good friend, President Ness. Thank you for being here today, and we are all aware of what you're going through and the leadership that you're providing to yourself and to Indian country in general on this issue, and the response by respective governments on this issue, in this instance, the federal government. President, the floor is yours.
Mm-hmm. Well, thank you, my good friend, Chairman Grijalva. Greetings from the Navajo people, Toyate, and thank you for hosting this roundtable. Also send warm greetings to my fellow tribal leaders who are so going these many battles that are happening throughout Indian country. Our warriors in the front line, once again, battling and fighting a monster called COVID-19. A couple weeks ago, it was stated that coronavirus or COVID-19 would wipe us all out. I want to tell all our listeners today that Native American people are resilient, we're overcomers, and we will get through this together. Our ancestors survived some tough times in our history. We Navajo survived the long walk, various plagues, and back in the 90s was hantavirus. We recognize that this silent killer is threatening our way of life, which is why we need all the support we can get, starting with federal dollars. So I am holding back some frustration, Chairman, but I am frustrated, and I think many of us on the panel are frustrated too, with seeing the slow pace at which our federal government has worked to get dollars out to Indian country. I know you're doing your very best. There also has to be advocacy from the current administration to help get these dollars directly to tribal communities. Federal agencies are using the same process that has been used every year, such as forcing us to apply via grant applications, which places on us hefty reporting requirements. Jumping through all these hoops, all the tribal leaders have been advocating for direct funding to tribal governments for a very, very long time. And this is an emergency. And so you would think the monies would go directly into tribal communities, but Chairman, it's been very slow. This is a global pandemic, we recognize. Indian country needs these dollars now. It's also upsetting to see how the voice of tribal governments has been ignored through this process. We are the first citizens of this country, and to be ignored during this terrible time is insulting to all of us. Federal funds should not go to for-profit corporations. And we all know who we're talking about. Half of this $8 billion might not even go directly into tribal communities because of that provision that is being heavily debated right now. So I think, Chairman, this sheds a big light, and I appreciate this panel that you're chairing, that it sheds light on the changes that need to occur with our processes, the laws, the regulations that oversee federal programs that help Indian people. You know, for the past several weeks now, many of us have been saying this same thing. It's been very repetitive, and I'm happy to say that there are some small amounts of money coming into the Navajo Nation. I am so grateful, and it's because of leaders like yourself, Chairman, that have been advocating for us there in Washington, D.C., holding this current administration accountable. So thank you. The Navajo Nation is a hotspot. As of yesterday evening, Chairman, tribal leaders, we have a total of 1,042 positive cases of COVID-19 here on the Navajo Nation. We passed the 1,000 mark here on the Navajo Nation. And that was an increase of 121 positive cases since Wednesday. You know, media has mentioned that the Navajo Nation has the third highest infection rate per capita when comparing our numbers and our population with the state of New York and New Jersey. See, New York and New Jersey and many other cities throughout the country are getting the aid already, almost immediately. And yet we're finally getting some of that financial support this week. But if you want to call it some positive or some uplifting news, of all the cases that have been tested, 3,440 have tested negative for COVID-19. And I want to highlight this number, Chairman, 41 confirmed deaths here on the Navajo Nation. 41 families that have lost loved ones. And can I ask all our tribal leaders and everyone that are listening to pray for all the folks who have lost loved ones. And that's just not here on Navajo, all across the country. And those are directly impacted by this virus, positive cases. You know, we appreciate the tests that are coming in, the Abbott, I think they're called, the rapid tests, those kits, analyzers. You know, it takes many tests to calibrate one analyzer. And yet they're saying that they're giving a whole bunch of tests to us. We have a bunch of analyzers that came in, but little do people know it takes a good number of tests just to calibrate one analyzer. And the other thing too, Chairman, is that these Abbott test kits, these analyzers, they don't have that many individual tests that we can get. So when it comes to having these analyzers, once we're out of these tests, then we're going to have to wait from this company. And those are decisions that we didn't make. It was decisions up higher in IHS and in the administration. The other thing I want to highlight, Chairman, and with all due respect to all my tribal leaders, all the tribal leaders throughout the country, I love you all. You're doing great work. But this statistic needs to be given, is that of all the cases throughout the Indian Health Service, 57%, the last number I got, 57% of the total within IHS are from the Navajo Nation. But when it comes to allocation of emergency dollars, that is not factored in the needs of some of these hotspot tribal communities throughout the country. 57% of all the positive cases are on the Navajo Nation. I have to say that. Yesterday, I issued another executive order to extend the 57-hour weekend curfew for 2 additional weekends this month and close all essential businesses due to the increased numbers we are seeing. This is an effort to prevent the spread of the virus. Other initiatives include having time and days specifically designated for our elders to shop. We also provide no contact services where families drive up to a food locations to get their items. And I appreciate the support. Outside groups, non-Native groups that are helping our Native American brothers and sisters throughout the country. They're stepping up while we wait for federal aid throughout the United States.
Thank you.
While individuals are out there wondering when some of these resources are going to come in, we are utilizing our own dollars. A lot of these tribes are utilizing our own dollars to help out in our emergency operations within our lands. But don't get us wrong. Don't get me wrong. I'm saving all the receipts. I'm sure all these tribal leaders are doing the same thing, because we're going to package that up and give it to Uncle Sam, and we're going to ask for our reimbursement. And, you know, with that said, we are the first citizens of this country. These dollars, these 3 bills that you all approved, Chairman, I appreciate that. Thank you. Sign into law. It was for the U.S. citizens. We're all U.S. citizens. Tribal nations are first citizens of this country. But sometimes we feel that we're pushed aside and we're bidding against each other. All these tribal leaders on the panel, we're all bidding for that finite resources of gloves, of masks, of gowns, face shields. And we're even bidding against governors. And it seems like the person with the most money gets the resources. I hate to say that, but that's just what this country is doing right now.
Thank you, Mr.
I love our country. Lastly, Chairman, there's going to be a fourth or fifth stimulus that we hear. Here's an opportunity to get tribal nations up to par with the rest of society here on the United States of America. 15 to 30% of our people on the Navajo Nation don't have running water, but yet we're telling our folks to wash your hands with soap and water. And we have a lockdown. People can't afford to be washing their hands every so often with soap and water. They're using it for drinking water and for their livestock. I can go on and on. Electricity, broadband. And I'm sure some of the tribal leaders will bring that up. I don't want to take too much of the time, but times are tough right now. But Navajo people and Indian country have been through a lot, and we will also get through this. We are a strong and resilient people. We will get through this together. Be safe, be compassionate, stay home, stay safe, and save lives. Thank you for inviting me, Chairman Grijalva and tribal leaders. God bless you. Our prayers are with you all. Our prayers are with you, Chairman, for wisdom, strength,
Thank you.
protection, and good health.
Thank you, my
God
friend.
bless.
Thank you, Mr. President. A couple of points that I think is important and something that the committee takes very, very seriously. And that's and one of the reasons for this panel today is to do exactly what the Lieutenant Governor said and you mentioned as well, Mr. President, is that we need to profile and bring attention to what is going on and not going on in Indian country with regard to the response to the pandemic, and as we talk about recovery, the economic recovery, and that how Indian country helps guide and define what that recovery should be in Indian country and for indigenous people in this country is going to be vital and necessary. I think we as a committee take our oversight and accountability for this money very, very seriously. You mentioned the money, the $8 billion that was put aside was for tribes and indigenous people in this country. It was not set aside for corporations. It was set aside for that purpose. And if that requires it to be a necessary fight that we involve ourselves with to follow what the CARES Act said and not to change the definition of how that money is used, that's a fight worth having. But at this point, I think accountability, this virus doesn't see Democrat or Republican as a label. It's indiscriminate in who it hurts. And it doesn't, and it shouldn't rely on political patronage in order to get resources to the neediest and where the hot spots and where the greatest need are. So I appreciate you and other Native leadership across this country making that point over and over again. I think it's important. Let me now introduce Diana Zero, Alaska Native Health Board member for Vice Chairwoman of Alaska Native Health Board for your comments. Diana, floor is yours.
Hi, thank you, Mr. Chairman and fellow guests. I know we have a hard cut at 10 o'clock or 10 o'clock my time, obviously I'm in Alaska, but my name is Diana Zero. I'm Vice Chair of the Alaska Native Health Board and participate in the Alaska Tribal Health System. I'm also Secretary of our Tribal Council for the Kenaitze Indian Tribe. On behalf of the Alaska Tribal Health System, I am honored to be able to participate in today's roundtable discussion to highlight both the impacts and our response to the 2019 COVID-19 pandemic, excuse me. Alaska has unique risk factors which expose Alaska Natives and American Indians to increased risks that require a more robust public response to the COVID outbreak. It is crucial to understand that many rural Alaska villages do not have running water, reliable internet access, nor easy access to healthcare facilities and hospitals, And I've heard that from our colleagues today, very similar situations. We know that the Indian Health Service system is underfunded and has created a lot of these issues. We rely on air transportation to receive prescriptions, medical supplies, medical equipment, food and domestic goods, and to transport specimens and patients. Furthermore, with a lack of adequate housing, multi-generational homes are common, and it is difficult for village residents to maintain social distancing. The Alaska Tribal Health System is a critical component of our state's public health system, which is grounded in self-determination and predicated on tribal sovereignty. We serve more than 177,000 Alaska Natives and American Indians, and the Alaska Tribal Health System is comprised of all 229 of Alaska's federally recognized tribes. Alaska spans more than 660,000 square miles, and over 80% of our tribal communities are off the road system. In this vast space, our clinic and health facilities are often the only access point of care, and as such, services are provided to all community members, regardless if they're part of our tribal population. The Alaska Tribal Health System also greatly expands access to care to all Alaskan veterans. If our member organizations cannot access the necessary resources to respond to the COVID-19 outbreak, then systematic response across the state of Alaska will suffer. Again, we're an integral part of that and need to be able to support that. Our people suffer disproportionately. Again, this has been said by other colleagues here today. Higher rates of heart disease, diabetes, renal disease. These are all identified by the Center for Disease Control as increased health risk for severe disease and mortality due to COVID-19. This makes our communities especially vulnerable to epidemic and pandemic outbreaks. During the 2009 H1N1 influenza pandemic, tribal communities suffered increased rates of mortality, which were 4 times the rate of other populations. In Alaska, we also live with the trauma of an orphan generation who lost their grandparents and parents to the 1918 flu pandemic, which disseminated entire villages in some of our areas. Alaska's unique risk factors, geographical and infrastructural challenges compound many of these issues, especially in our most remote communities. There are more than 3,300 homes and 31 communities throughout Alaska that do not have running water and sanitation infrastructure. This risk factor alone, as has been stated again by many of the colleagues before me, threatens our communities and hits at the heart of one of the core public health measures to combat the coronavirus, washing our hands. We simply can't do it. Being able to get non-water hand sanitizing agents to these vulnerable communities is a gap stop to bolster their frontline defense against the spread. It is not the end all, though. Congress must prioritize these communities in the long term by providing funding to deliver adequate water and sanitation solutions beyond the coronavirus. Doing so will save countless lives and protect our communities if and when the next pandemic strikes. Our health system is built on a network of referrals that span, our health system is built on a network of referrals that span thousands of miles, requiring our patients to rely on air travel to get to and from places and points of care. Due to the COVID-19 crisis, most commercial transportation in Alaska has been grounded, and travel must now be arranged by charter services and medevacs, further exacerbating this challenge. Last week, the largest regional air carrier in Alaska, Raven Air Group, filed for bankruptcy, leaving many communities without air service entirely. As healthcare services rely primarily on air or barge transportation in rural Alaska by necessity, it means that travel restrictions and the loss of services have impacted access to necessary care, including non-COVID conditions. Without the access to these modalities, shortages for everything from prescriptions, medical supplies, medical equipment, food, heating oil are beginning. The lack of the ability to transport lab specimens to the state public health labs for testing in a timely manner has also been impacted. We too have received the Abbott system, but it doesn't, again, with lack of supplies, it doesn't cover all our needs. Additional flexibilities for funding to cover the cost for chartering flights to get medicine and medical supplies to communities off the road system, and to send patients to healthcare facilities when necessary must be considered. In this new environment, affordability and support for telehealth care to these populations is crucial, especially for chronic conditions which fall outside the current emergency funding and should be factored in the overall cost of our response to COVID-19. There is immediate need for resources to increase bandwidth and access for rural communities, shifting to virtual delivery of everything, not only our education systems, but communications with our family and friends, to the medical care issues that we've identified. Alaska Natives often live in multi-generational homes. And again, I know my colleagues have mentioned that as well. And while we consider this a cultural strength and value, it offers a unique risk of exposure to our elders and other family members who may be susceptible to the virus. There's a critical need for funding additional housing as well as facilities for quarantine, isolation, and alternative sites for delivery of care to patients who suffer from the COVID symptoms. Our short construction season, it requires that this funding is immediate so that we can arrange to make delivery arrangements to bring this here this summer. Through our traditional values and culture, our tribal population will be resilient and innovative in effectively utilizing the resources provided to ensure that we not only survive this pandemic, but thrive into the future. Again, on behalf of the Alaska Tribal Health System, I wish to extend our sincere appreciation for the opportunity to share our concerns with each of you today. Be safe, be healthy, Chiknik, in my language, thank you.
Much. And if we could stay for just a little while to have some Q&A, and let me begin by asking the panelists, the governor, the president, lieutenant governor, and all of us, all the people on the panel, the issues as we know them and as you know them much better. We're dealing with issues in Indian country, and that also issues dealing with lack of access for urban indigenous folk that are in metropolitan areas and in cities, and the need for their health centers and providers there to have the adequate resources to deal with that as well. But transportation, sanitation, water, the 25% match waiver, the economic stabilization, what has been lost with third-party billing, the capacity issue, both protective equipment for frontline workers and for people in general, and testing kits, and the issue that was brought up by President Nez about direct funding, where the tribes have a bigger say. Because one of the frustrations on conference calls with agencies is that, no, this is FEMA's responsibility, CDC's responsibility, BIA's responsibility, IHS's responsibility, Department of Interior's responsibility, and the list, Treasury's responsibility. And so in this swirl of where do you access and the resources that have been intended by Congress for Indian country, that has to change and change dramatically. But one of the issues is that I think is key to that is the tribal consultation, and if as a means to assure that tribes not only are being heard, but that their recommendations and their guidelines and their guidance is being followed. So if anybody could respond to the issue of consultation, because I see that as central moving forward to making sure that the things that we're talking about on this call are taken care of. I have opinions. I don't think this Department of Interior holds that issue, the trust responsibility issue or the consultation issue. It's one of our priorities, but this pandemic has made it a priority. And so if there's any reactions to the points I just made, please.
Right. Chairman, let me just quickly, I'm sure there's other tribal leaders can answer some of the other concerns and questions that you had, but in particular with tribal consultation, sir. There is a definite need to have everyone on the same page. And when I mean that, it's up in the federal government, up there in the administration. You know, previously there was a White House Council on Native American Affairs, which brought all the cabinet members together. And just imagine if we were to do that during this pandemic for tribal nations, all these departments, federal programs could all get their updates all at once. How many of us tribal leaders are on the call from 7 a.m. to 8 p.m. at night? Tribal consultation, or either someone from the White House wants an update, or no, they're giving us an update. They're not even allowing us at times to say anything. Then you got Department of Interior call. You got the Bureau of Indian, you know, the list goes on and on. And so I think there needs to be a group there in the federal government. Yeah, we have this White House group that's chaired by the vice president. That's great. But there also needs to be a group there, federal government, from various programs, so that we all give them an update at one time. See, that was the same thing, Chairman, as you know, that was happening to us with over 30 congressional delegation that we had. We had to be on the call with Senator so-and-so, Representative so-and-so, every so often, and say, you know what, enough. Let's just do one call, get all these leaders onto the phone and give one update, because we're boots on the ground. Well, right now I'm stuck in my cave because of being in close proximity to a COVID positive patient or person 9 days ago. But who's counting, right? Once the 14 days are up, I'd like to get back into the war, into the battle with the warriors, and fight this monster. And the resource site, I mentioned this yesterday on the White House call. There should be a Native American resource page, resource site, because now I'm afraid for, you know, some of us, including as big as Navajo, will lose out on an opportunity. Just imagine some of the smaller tribes, they won't have that capacity to track every funding line item that's coming from the federal government. It'll be very helpful to have a one-stop shop site, maybe, that the federal government can identify, okay, this is public safety, this is for health, you know, and have a resource site so that and know what they can apply for from these funding opportunities. Lastly, border towns. You said outside our Navajo, outside our tribal communities. I appreciate the help that federal government is giving. Thank you for passing the relief bills. But guess what? In tribal communities, it's like the first of the month all over again right now. Everybody got a stimulus check, and I'm sure it's like that clear across the country. When you have a little bit more money in your bank account, you're going to want to go to town. You're going to want to go and buy things. And here we're telling our citizens to stay home, avoid large gatherings. But I've seen high numbers of people going into our border towns for these big box stores. And it goes against with what many of us are trying to do, is try to keep our citizens at home. You know, Vice President Myron Lizer and I have been on so many calls, and we miss calls too. You got one earphone, one earpiece in one ear, and another call on the other ear, trying to make sure we get all the information that we can that's coming from the federal government. There's an outbreak, and maybe I'm the only tribe nation. I need to say this, that some of our folks are struggling with substance abuse, alcohol and drugs. and you get a big check or you get a first of the month check, you're going to the border town to go get your fix. And there's a spread in Gallup now of our relatives that are wandering the streets there. I don't call them homeless. They got homes, but they're there because of substance abuse problems. There should be some more aid for those individuals as well that are in need of quick attention and care. So I'll stop there. I know that other tribal leaders are going to add to what I've said as well and what your questions were. Thank you, Chairman.
Yeah.
Chairman, this is Governor Chavarria from Santa Clara.
Please, Governor.
Yes, and that's one of the concerns that I did have and raise on, as the President was saying, on the White House cause that we have for Tyler Fish and IHS Admiral Ryaki, Assistant Secretary Sweeney. So one of the things that I've been pushing for is the National Disaster Recovery Framework. This National Disaster Recovery Framework was tailored after Hurricane Katrina that brought all these federal agencies, officials together from Treasury to BIA through HHS. Here's my list of all my conference calls for the week. And I try to make these calls because if we're not there, there's a lot of information that we're missing out. And so part of the recovery support strategy, the National Disaster Recovery Framework is a recovery support strategy. In that recovery support strategy, it outlines a short, mid, and long-term process of which federal agency, which state agency, which tribal resources are available so that we don't duplicate efforts. And so that is very critical. And I've been pushing that through Tony Robinson, our female Region 6 regional administrator, that this only way to this could be done is on a regional approach, because that is very critical at this time, Chairman, members of the committee, because we can't, as tribal leaders, afford to be on all these calls, but I have to. And so, yes, if we have a call for 3 to 4 hours on a specific day, then at least we're sharing resources of exactly how the CARES Act was intended with all those various tribal provisions to support tribal governments. And so that's a suggestion, Chairman, that we have to do that is implement the National Disaster Recovery Framework. So now I go into the unfortunate situation that we came up upon. I understand through the CARES Act, it was Congress' intent to be flexible and have that direct funding down to us as tribes, pueblos, and nations. But then we got stuck on the payroll or paycheck protection program, the PPE through the Small Business Administration. Congress created the PPE specifically that tribal business concerns would be eligible. And because tribes do not have a traditional tax base to generate government revenue, as a result, it is even more critical that any tribal business concern, including gaming enterprises, are deemed eligible for the PPE loan program. Tribal casinos, including those less than 500 employees, comprise of hotels, conference centers, restaurants, entertainment venues, and again, many of them are the biggest employers within that region, income generators, not just for tribal, but for non-tribal communities. And so that's very important. And I was saddened because tribal enterprises, specifically gaming enterprises, were not deemed eligible for that. Well, Congress intended to apply that PPE or PPP program broadly and flexible for all tribal business in particular. Again, the tribal governance, unique political entities with a government relationship with the United States of America. So lastly, the thing that I'm very concerned about, Chairman, and I talked about earlier, was the federal government agencies are still pushing over 700 or 70 policies that have significant impact on public lands, wildlife protection, oil and gas leases, meaning that they're still trying to hold tribal consultation sessions in light of this global pandemic. I understand the Interior has taken some steps to pause However, we urge the department to take a next logical step, which is to suspend any of these policy decisions and focus on addressing the response of this COVID-19 effort. Because we are not in a position to have face-to-face government consultation, which I don't call this type of session government to government, Chairman, with a federal agency, because it requires public comment. So that has been our push from the All Public Council of Governors as it relates to Department of Energy, as it relates to US EPA, as it relates to Department of Interior, BIA, and BLM on these various policies, because it is unfortunate that we're not there in the same room to have that adequate dialogue of that government to government consultation. And that's a critical component of the federal trust responsibility, is that mandate to consult whenever a federal action may impact our tribal communities. Again, our relationship with the federal government is not race-based. It's based upon the political status of us as sovereign political governments. And sovereign tribal authority is inherent upon us and predates any form of law in this country, recognized in the United States Constitution, the treaties, federal Indian law, executive orders, Supreme Court decisions, all recognize the inherent powers of self-governance that are exercised by tribes. Again, due to our sovereign national status, tribes are political entities and not racial groups. And so that's very important, Chairman. I know you understand this. I met with you a couple of times, but I wanted to express this because unfortunately, Congress intended the wide tribal provisions in care to be flexible, but yet when it got to the federal agencies, there was more roadblocks put into place. And now we're having to fight that type of challenge. We can't afford to give up. And so I think that's some of the next things we communicate on how do we fill those gaps in the next possible CARES 2, whatever phase 4 and phase 5 legislation are gonna look like, but we're here willing to support you and help you, Chairman. Our doors are always open and I always want to work together. So thank you again for allowing me additional time.
And thank you very much for your comments. We are very concerned on the committee that what's going on behind the curtain as we're dealing with this pandemic, that the Department of Interior, EPA, and other agencies are not promulgating policies, regulations, guidelines, rules, dealing with extraction activities and other activities on public lands until we have a clean bill of health, Indian country has a clean bill of health, and then we can get back to the consultation process that is required. Right now, I worry that while we're busy looking at the crisis in front of us, other people are busy trying to get things done that otherwise would have been very, very difficult under a normal circumstance. I appreciate that point, and I appreciate your comments on consultation and emphasizing the sovereignty issue that I think gets lost in these discussions. But let me ask the Lieutenant Governor. I know she needs to leave, and if there's any comments that you might have it, or any reaction to the discussion as we're having at this point.
Thank you, Mr. Chairman. And I would just again say it's an honor to be on this call with tribal leaders. And I'm grateful for the work that you do for your communities every single day. My hope would be, as we're talking about consultation, especially around the issue of the Treasury and the disbursement of funds, that we don't reinvent the wheel here. There are guidelines and there are things that have already been put in place that I think there's an opportunity to follow. Senator Tina Smith and I issued a statement collectively today, which is not our usual practice, to be sure, but just to emphasize the need for these funds of the $8 billion to be to go out fairly and equitably. And as you mentioned, Chairman, the original proposal was $20 billion, and I would argue that we need to continue to fight for those funds for Indian country and for our people. So again, thank you for your advocacy. I am just honored and privileged to be able to work with our tribal leaders in the state of Minnesota, who are incredible leaders and mentors and teachers for me. And that we are trying to model, frankly, true government to government relationships and consultation. And we're able to do this. And I just share this because my hope is that other states might be able to follow some of the things that we're doing with an executive order, calling for consultation, tribal liaisons at each state agencies. And in partnership with our legislature, we were able to pass $11 million in a tribal assistance relief fund that goes directly to tribes to spend in the way that they deem fit. And that can help with FEMA reimbursement, food support, or additional things that our tribal leaders, who are leaders of their own communities and can make the decisions that are best for their own people. But we're doing that in the interim while we're waiting for these funds to be dispersed, which are so badly needed. So in the next packages 4 and 5, Chairman, I know that you and your colleagues will ensure that Indian country is front and center, and I will do all that I can from Minnesota to try to amplify that good work to ensure that our people are not forgotten. So Chimigwich, I'm just honored and humbled to be with you all today. My prayers and my thoughts are with all of you, and Governor Wall says hello. Chairman.
Thank you.
Thank you.
Ms. Church, I know you need to leave as well, and if you have any comments that you would like to include, and time is yours.
Thank you. I thank you again. The other thing that this pandemic has really brought to light in the Great Plains is the diminishment of services and infrastructure for hospital care. For a couple of decades now in the Great Plains and across Indian Health Service, the trend has been to close hospitals and stand up clinics. And we are seeing the devastating effects of that right now. Many of our hospitals are not equipped to handle more than just a few patients. Some have ventilators, but some don't have the personnel to run the ventilators. And so I hope that this brings about the awareness that we should not be diminishing services in rural areas. We should not be closing hospitals and turning them into clinics, that if anything, we need to go the other direction. I hope in future packages that are looking at infrastructure that's remembered, and so that our tribal governments are not caught off guard again in the midst of a pandemic or any other medical emergency.
And I see that that recommendation as part of, I think, going forward as prevention and going forward as a wellness agenda for Indian country. And like I said, you walk through this portal and suddenly things are much different. And I don't think status quo is going to work again.
That's right.
And if there's I think one of the most important examples is what's going on in Indian country, perspectives that are changing among the majority. I think is important, and I think your suggestion is well taken, and I think forward looking. What do we do when we recover?
Yes.
And thank you.
Thank you.
Ms. Earl, do any comments you wish to add?
Thank you. Thank you, Chairman. I really concur with a lot that has been said. The issue of trying to consolidate these teleconferences that are out there, they're very helpful with information that we need to make decisions, but it's very, very hard, as you know, to keep track of everything and to make sure then it's put down to our staff. In our case, in our tribe, we have approximately 300 employees, and we've had to take most of them off-site some that are actually totally furloughed at this point in time, in order to ensure that we can have our healthcare providers provide care in a healthy and safe manner. Throughout Alaska, that occurs. And again, we're all talking about being on teleconferences from 7 a.m. till sometimes late into the evening. We're meeting with our tribal leaders. And I think that's one of the things that the Alaska Tribal Health System does very well, is that we do put on a united front. And I would encourage that across Indian country, because I think that's where our voice is being heard, when we're united and working and listening to each other on some of the solutions. In forward funding, I think it's really important that, as we talked about, and I've heard from I think almost all the leaders today, is the infrastructure needs. We know that Indian Health Services is poorly funded, are underfunded, and that we're not able to meet those needs. So when a situation like this occurs, we're not able to overcome some of the basic needs of it, such as washing our hands. So water, sewer, air transportation, road systems, all of that, I think across Indian country is severely lacking. And so any efforts out there that can include funding to ensure the long-term funding of those issues will be very important. I too appreciate all the efforts that have been made. I have listened to, at times at some of the teleconferences, there are 600 to 700 tribal leaders there. So I know the concern is there, and we're all listening for opportunities where we can handle this to ensure that our communities are not negatively impacted. So with that, I thank you for the opportunity again today. Thank you.
Thank you very much. And in closing, let me thank each and every one of you. I think for the people that have joined us, I hope it has, to some, has been an eye opener as to what it still needs to be done. And one of the issues that I think is important, and the committee takes as a serious responsibility, the Natural Resources Committee, is that we're not there to speak for Indian country. We're there to facilitate that the relationship, the trust relationship is respected and implemented, and we're there to assure that the respect extended to sovereign nations and to indigenous people across this country is also a priority. And we've been somewhat successful, but not to the degree that I would want, and certainly the panelists want. And going forward, let me repeat, I think the status quo will not be enough in Indian country. Things have changed, and this pandemic and our struggle to defeat it has opened eyes. And as we go forward with the recovery, I hope it opens doors too. And thank you so much. Your recommendations and your guidance is needed, and we've all learned much. And going forward on the next packages, our job distinctly and clearly is to make sure that we talk about direct funding, consultation, comprehensive communications, and not to either like overt or benign neglect that Indian country be left behind. Thank you so much, and I appreciate your time more than you know. Thank you very much.